Thank you to both Dale and Gordon for helping to organize this talk this evening, and grateful to the sponsors as well, including my own parent organization. So on that note, I think I'll start with a disclaimer. The views that I express today are my personal views and don't necessarily reflect my employer nor the partner agencies that are involved with the My Health, My Community project. So just in case. Now, in kind of putting this talk together, clearly there's a huge data element to this talk based on the work that come out of the My Health, My Community project, which is a survey that was launched here in 2013. I'm just curious to know how many of you in the room are actually, first of all, heard of the survey, and secondly, participated. So can I say, heard of the survey? Okay. Participated? Okay. So that's good. So this is going to be a new audience. Hopefully you haven't heard some of the results that I'm going to touch upon. But before I get into some of the findings and the context behind the relationship between transportation and health, I thought I'd start with a personal anecdote from just 2 days ago. I was in Squamish. Councillor from Squamish is here, where I was speaking to the Squamish District Council about some preliminary findings from the My Health, My Community. And I have to say I had a very pleasant journey up to Squamish. Took me just over an hour and 15 minutes, around midday. Despite the lashing down rain on the sea to sky, it was actually quite a nice drive. I was actually looking forward to returning later that afternoon and getting down to preparing this talk. And unfortunately, I think I experienced what this region of Metro Vancouver is now becoming synonymous with, and that's congestion. And the journey that took me an hour and 15 minutes to get up to Squamish took me well over 2 hours for me to return. And as you can imagine, I was a little bit frazzled by the end of it, and I was not really in the mood to sit. I shouldn't have left, I know. I should have gone to the pub, right? Yes. The Squamish has some of the higher rates of alcohol consumption in the Lower Mainland. And so after that, I thought, okay, I just need to get out. And fortunately, I live in South Vancouver, down by the river. And what better thing to do than to get out on the bike and actually just go riding on the river trail. I like getting out into that space just to start thinking. And I think it really got me into my Zen kind of state for me to kind of start thinking about, okay, what exactly do I want to convey to this audience here? Other than, obviously, the hard quantitative data that comes out of My Health, My Community. Well, I thought about transportation. As Gordon introduced me, I've lived in a few places. I've had the privilege of using a number of different transportation systems over the year. And I started to reflect on how did I actually get into using public transit? Because I certainly, living here in Metro Vancouver since 2007, have encountered lots of people who aren't as familiar with the public transit system, and partly because I think they come from a very car culture. So it surprised me a little bit when I first came here in 2007, and started me reflecting on how did I actually get into transportation. And my journey in public transportation actually started at the age of 11. I grew up in Hong Kong. And at that time, I lived on the south side of Hong Kong Island in an area called Stanley. And my school was right the other side of the territory over in Kowloon Peninsula. And so from the south side to right to the north there, the red line indicating the journey. And that particular journey is only about 18, 19 kilometers in distance. But it's uphill, downhill, across the water, and then through some of the most congested parts of Hong Kong. And I was thinking about this journey, and I thought, and for those who just as a sense, kind of context, that distance from Stanley to where my school was, my secondary school, was about the same as the distance from Richmond city center right down to waterfront. It's about this equivalent distance. And that journey took me every day an hour and a half one way. So I was spending 3 hours a day on public transit. And it would start off with this number 6 bus, good old Leyland Bus Company, the Scottish bus company. And this bus journey would take me 45 minutes, uphill and then downhill. And actually one of the scariest parts of this journey was that the roads from Stanley to the center of Hong Kong were actually fairly narrow. There is not enough width for more than one bus. And alongside that, as you're going uphill, the cliffs, there's about a 200 to 300 foot drop with a retaining wall that's no more than about 2 feet high. So it's quite a hairy ride, and I would encourage you, those of you who ever go to Hong Kong, sit on the number 6, at the top deck of the number 6, right at the front, and you'll want to hold on to those handlebars as you start going downhill with that 2-foot retainer wall on one side. So that was the first part of the journey, 45 minutes. The second part of the journey was actually very serene. This is what National Geographic calls one of the top 10 kind of things to do, you know, in terms of transportation around the world. That's to take this 7-minute ferry crossing between Hong Kong Island and Kowloon Peninsula. So that was part of my journey every day, there and back. And then, followed by probably the most exhausting part of the journey for a number of reasons, which was the Kowloon motor bus service from Star Ferry Terminal to my school, which took about 35 minutes, and it's a fairly short distance, but as you can see, that's the kind of congestion that it was dealing with, traffic light after traffic light. And my school wasn't necessarily accessible as easily by the underground system that some of you may be familiar with in Hong Kong. And so that was my journey for about a year, an hour and a half. And I think ever since that, I never really looked back on public transportation. Everywhere I've lived, I've always used different modes of public transportation combined with walking and cycling wherever possible. So that brings me to the subject at hand, transportation and health. Now, I am not going to go into too much detail about the evidence around transportation and health. I think there's a wealth of evidence out there. And to be honest, for those of you, and I believe you're an engaged audience, you must have seen some of the information that's been released over the past month or so. And in particular, if you're not familiar with this area, the one piece of work, if you were to pick up the report by Professor Larry Frank from UBC, who wrote a very nice literature review of various studies examining the relationship between health, transportation and health. But in essence, there are 5 really key areas that we need to consider. Firstly, physical activity. We know that most transportation journeys begin and end with a walk. And depending on the mode of commute, that can actually extend to quite a significant part of your day. Secondly, around air quality, we know that increasing congestions, while we may not have the congestion that some of our Asian neighbors cities might have, like Bangkok, Hong Kong, Beijing, Delhi, we certainly do have enough congestion that impacts the air quality in the Lower Mainland. Thirdly, mental health. I think my personal anecdote speaks to that, but there is a lot more convincing evidence out there, observational data that's been done over years that has suggested that your choice of transportation mode can influence your mental health and the levels of stress that you experience. Fourthly, around injuries, we know that with decreasing use of cars as a mode of commute, we actually see decreasing road traffic accidents as well. And that evidence is consistent from a number of different jurisdictions. And then finally, equity. And I think this is one issue that I feel quite strongly about, and it's an issue that I think the data that we have in My Health, My Community demonstrates as well. There is an inequity across Metro Vancouver in terms of transportation infrastructure, but there's also an inequity in many other jurisdictions. And I'd like to share with you some of that evidence that we have locally. Now, whilst I encourage you to read Professor Larry Frank's report, I think one of the strongest study that I came across that I kind of feel is a good one. If you were to look at any one study, this would probably be the one. And the reason why I say this is because the Los Angeles to Culver City Exposition Light Rail that was opened in 2011, 2012, is a similar kind of infrastructure project to what's being proposed here in Metro Vancouver. And in fact, the distance from downtown Los Angeles to Culver City is about the same as the distance between Surrey Central and Langley Center. So it's about equivalent. And this particular study used a design that was a before and after study of households that were recruited in 2011 before the line opened. And they chose households that were living within half a mile of the proposed line and compared them to households that were living greater than half a mile away from the proposed line. And prior to opening of the line, they found no differences between the experimental and control households in travel patterns, as well as certain lifestyle behaviors. But after opening, this is the part that was really quite striking. And I think a lot of studies that examine transportation health are based on cross-sectional surveys that may be correlational in nature, whereas this one has a bit of a demonstration of causation with a control group. So after opening, they found that those living in the experimental household reduced their daily vehicle travel by 10 to 12 miles. Fairly significant. On top of that, that reduced vehicle traffic led to reduction in CO2 emissions in the area by 30%. And critically, I think this is the one that really stuck out for me, is that they experienced an 8 to 10 minute increase daily in physical activity after station opening. And that's just looking at those that were the least physically active. They were gaining an additional 8 to 10 minute increase. Now, the recommended physical activity guidelines is 150 minutes a week or 30 minutes 5 days a week. And so if you think of it, you're achieving 1/3 of your recommended physical activity just by using that as a transportation option. The study never had time to look at the social and economic impact, but it is anticipated with the changing land use around the light rail line, as well as the potential increase in household value. There potentially is going to be some sort of social and economic benefit that comes to those living in the area. In some ways, similar to some of the changes we've seen along the Canada line here in Metro Vancouver as well. Now, in terms of physical activity, I think the evidence for this has been around for many decades. And I want to really emphasize that there's nothing new in this association between physical activity and health. It's about maintaining healthy weight. It's about reducing risk of chronic diseases. And it's been shown convincingly, repeatedly, in so many different areas that it contributes to a 40% reduction in premature mortality, right? Yet, very few of us actually meet the recommended guidelines. Across Canada, we know that British Columbia generally tends to do better on physical activity, amount of participation in physical activity, and in Metro Vancouver, we tend to have the highest rates of participation in physical activity. Still, that only equates to 40% of the population in Metro Vancouver meeting the recommended physical activity of 150 minutes a week. And the evidence for this has been out there for decades. And I think, one of the things when we think about the association with transportation and health is that to what extent is it choice or design that has contributed to this contribution of physical activity to ill health. And being a student of epidemiology, I think in my previous work before I came to Vancouver, I was in England, and I had the fortune of working with some of the most eminent founding fathers of epidemiology, the field that I did my PhD in. And one of them that I'm pretty sure most of you all know or should have heard of is Sir Richard Doll, who found the association between smoking and lung cancer. And he was the English epidemiologist that did that work in the 1950s. At the same time, his colleague, a Scottish epidemiologist, Jerry Morris, actually did some of the most important seminal work showing the relationship between physical activity and chronic disease onset. And I wonder what both of them would think about the way that obesity is overtaking on premature mortality, the way that smoking was many decades ago. So I think there's an interesting parallel here. Unfortunately, both of them have passed on, but I did have the fortune of meeting both of them in my early days. Now, speaking of physical activity, it's really that physical inactivity, the sedentary behavior that really contributes to ill health. And this is, again, work done by Larry Frank here at UBC. This is a study that was done with colleagues looking at the commute time in relation to risk of obesity in Atlanta, in the suburbs of Atlanta. And even there, when you just look at, for every hour increase of driving per day, there was a 6% increase in risk of obesity. And with some commutes being incredibly long, that very strong dose-response relationship with increasing duration of driving, increasing risk of obesity. Now, when we think of physical activity, I think one of the areas that we should be very grateful for the work that Dale and others do in the Metro Vancouver region is really around promoting active transportation. And I think the evidence, again, there is fairly convincing. Those that walk or bike achieve 70 more minutes of physical activity per week. That's halfway there to your recommended physical activity levels each week. And then, similar to the work that came out of the Culver City light rail, 8 more minutes of physical activity per day for those that use transit. And I think as much as we think about our day and how do we fit in physical activity, isn't it great you can fit it in as part of your normal commute every day? Now, the other issue I want to touch upon is around equity. And this is about having equal opportunity in society. And I think when you look at some of the maps I'm going to show later, the one thing that will strike you is that there is unequal opportunity across Metro Vancouver to participate in active transportation. So from an equity perspective, how do we address that in the long term? And certainly there's work that's come out from other jurisdictions, and right from here in Canada, from Toronto Public Health, where they did a report in 2013 that says, public transit enables all residents to access the determinants of health, maximize health-related opportunities, and fully participate in urban life. That access includes employment opportunities, education opportunities, health services, social and recreational opportunities, as well as healthy foods. So between meeting those basic necessities of life in terms of your economic and education, but also your food, but also socially connecting you to your community. And they also noted that those that experience the worst end of the inequity are the vulnerable populations, such as the low-income families, new immigrants, children, youth, and seniors. So, and that particular report has a number of suggestions around how do we tackle this inequity. So, that brings me to the My Health, My Community project. This was a project conceived back in 2009. Unfortunately, I shelved it for the Olympics and revisited it in 2011. I think in between the Olympics, getting married, having a daughter, I think life just got a little too overwhelming for me to focus on this. So my apologies if anyone feels this is too late. But the initiative was really about getting us to start to think about our community in a different way, trying to look at the bigger picture to how we live, where we live, and how we interact with our environment. And this project was a collaboration between Vancouver Coastal Health and Fraser Health, right across the lower, to make sure we encompass the entire Lower Mainland. And I think this was really important for me because I think for most members of the public, health authority boundaries don't mean much, do they? Do you know where Fraser Health starts and where Vancouver Coastal Health ends? No, right? Station Road. Well, Boundary Road, Burnaby is one of the markers, but Station Road. Okay, yes. Yeah. So this initiative was developed to make sure that we could reach out across the geography that related to people that lived across the Lower Mainland, and that way they could think about the community in a different way. Now, what I'm going to do now is I'm just going to switch, and hopefully the technology will work. And I'm just going to play for you the video that kind of gives a really nice intro to what this project's all about. And hopefully it works.
Everyone knows we are what we eat, but we're also where we live and what we do. We think of being healthy as eating right, exercising often, and seeing your doctor. But it's much more than that. That's where My Health, My Community comes in. Being healthy is about how we live every moment of every day. How long and stressful is your commute? Do you have easy access to parks and community centers where you live? Can you take time to enjoy simple pleasures like just hanging out with good friends and family? We believe it's all connected and that the key to being healthy lies in understanding those connections. By visiting myhealthmycommunity.org and taking the survey, you'll be helping us to learn how our lifestyles, our neighborhoods, and our environment all work together to affect our overall health and well-being. Your answers will guide community groups and local governments in shaping future programs and community services that will benefit you, your family, and your neighborhood. My Health, My Community, your voice for a healthier community. Be a part of it.
So that's the basic kind of background to My Health, My Community. This was our video that was launched in 2013 when we started the survey. For those of you that haven't participated in the survey is closed now, but stay tuned. If we ever get funding, there will be a second phase to that. And the other thing I want to point out is our kind of understanding of our community included the understanding around those that participate in active transportation. And we built that into the survey. So the survey was not designed around the transportation referendum. It just so happened we had data that could inform the discussion and debate around the transportation referendum. Now, one thing we did very purposefully in the survey was to try to capture something that typically doesn't get captured very well in a lot of health surveys, and that was a recognition of the social determinants of health. When we think about the health of our communities, we know that 60% of what influences the health and well-being of our communities is shaped by the social, economic, and physical environment in which we live. Yet we do a very poor job of understanding that at a granular level, at a level at which we can make interventions. So that was one of the key things we wanted to achieve by this survey. The survey itself encompassed over 90 questions, and they covered areas around sociodemographic factors, your health status, lifestyle behaviors, healthcare access, in particular primary care access, your built environment in terms of how you interacted with your neighborhood perceptions, your mode of commute, etc., and as well as your elements of community resiliency. How connected are you to your community and your surrounding environment? And the results of this survey are going to be, obviously we've released the Transportation and Health Report last month, but we are releasing more report in about a month's time that documents all of these characteristics for over 30 municipalities across the Lower Mainland. So that report's going to be coming out in about a month's time, right, Marisha? Before Marisha goes on mat leave. Now, the survey itself was designed to be primarily online in English and Chinese, but it was supplemented with a paper version that was in English, Chinese, and Punjabi. It was only administered to those aged 18 and over. And we used a number of different tactics to make sure that we got a representative part of the population. We had a number of community partnerships with local governments and nonprofits to make sure that we reached out to all segments across all municipalities. We had a very active outreach team of about 20 field surveyors that would go to community events and various transportation hubs and survey people, as well as offering a number of incentives through both social media and print media as well. Our overall target for the Fraser Health and Vancouver Coastal Health region was to reach 2% of the adult population aged over 18. And this may seem small, but the thing that I have to remind you is that all national and provincial surveys capture less than 0.5% of our population. And we know from our experiences with using surveys like the Canadian Community Health Survey that Stats Canada does, the sample that participate in that is not necessarily representative of the populations that we serve. So we were very conscious right up front to make sure that we reached all segments, and we use census data to guide us down to a neighborhood level to understand what was the age, sex, ethnicity, education, and income background of the individuals in every single neighborhood to make sure that we were hitting appropriate targets to get that representativeness. And this was quite tedious work, but we were doing this on a weekly basis, monitoring the progress, and then moving our field surveyor team into locations where we were underrepresented. And we did this for a whole year. As with most surveys, after the survey data is collected, you do a post-collection weighting. And all that post-collection weighting doing is taking your sample that you've got and conforming it to the population distribution that you want to speak on. Because we were purposeful up front, it means that our post-collection weighting is fairly minimal. And it means that the results are actually a lot more representative of your communities. And for the first time, we actually have data down to neighborhoods within municipalities. So at the end of the 1-year survey period, we ended up with close to 34,000 respondents, making it the largest community health survey conducted in Canada, so for the Lower Mainland region. So of those 34,000 respondents, we had 28,000 respondents that lived in Metro Vancouver, and we decided to take a look at, amongst those 28,000 Metro Vancouver residents, what proportion of them indicated a regular mode of commute to work or school. And of that, we found 80% of that 28,000 indicated that they regularly commuted to work or school. And that forms the basis of the analysis that I'm going to speak to now. So what do we find? Across Metro Vancouver, 55% of Metro Vancouver residents use a car either as a driver or passenger to commute to work or school. In terms of public transit, 29% indicated using public transit, 10% walking, and 4% biking. So overall, in terms of active transportation, 43% of Metro Vancouver residents use active transportations as a means to get to and from work or school. So how does that look? Clearly, 43% sounds quite impressive, however, and really in line with some of the numbers that Dale had shared, but there are discrepancies across Metro Vancouver. And this graph tries to illustrate that. So the blue bar there is that Metro Vancouver value that I spoke to, 43%. And what you'll notice is that there's only really 4 communities that are doing very well in terms of active transportation. And that is Vancouver, obviously, New Westminster, Burnaby, and the city of North Vancouver. I think if you think for a minute about some of the transportation infrastructure that's available there, it's not perhaps unsurprising to see that. But there is tremendous variation, and as you can see, one of the things that the Mayor's transportation plan is trying to do is trying to address those gaps in active transportation in other jurisdictions. In other municipalities. And if we look at the flip of the active transportation in terms of those that are car dependent, you'll see Langley Township, Maple Ridge, Port Moody, Pitt Meadows, many communities that are significantly higher than Metro Vancouver for their car dependency. So we took a look at those groups of their commute modes, and then the next thing we wanted to do was try to look at the association between their commute mode and certain health and lifestyle behaviors. And we decided to look across obesity, so measured by BMI. We did actually ask for BMI. We looked at their wellness score, which is a marker of positive lifestyle behaviors. It essentially looks for lifestyles that are characterized by healthy eating, meeting your physical activity guidelines, not smoking, as well as walking on a daily basis, 30 minutes or more. We also asked the same question that Dale's looking at around self-reported health, how individuals rated their health. And then the other thing we wanted to assess was social connectedness. And the best question that's widely used is the sense of community belonging. And the sense of community belonging is not defined by geography or by social group or professional group. Is deliberately left vague. I think the idea here is to capture how connected you are to a community, however you choose to define a community. And we looked at the associations for active transportation overall in relation to car users, and then we looked at it separately for cycle or walking, and then transit. And what those green circles indicates there is where there is a statistically significant positive association. So for active transportation users, they are statistically significantly more likely to have lower body mass index, more likely to display positive lifestyle attributes, more likely to meet the walking guidelines of 30 minutes a day, more likely to meet the physical activity guidelines as well. However, there was no association with self-reported health or sense of community belonging. However, when we just look at the subset that cycle or walk, again, you will see right across the board there's a statistically significant association. And these associations are adjusted for a number of factors. Again, a number of studies that have been done in the past don't collect the wealth of information to make the appropriate adjustments, but we're able to control for age, sex, income, education, ethnicity, whether you had an underlying chronic disease, accounted for your commute time, what physical activity you may already be participating in, your time in Canada, because we know immigrants have come from many different jurisdictions with different commute behaviors, as well as how close you live to a transit stop. And after adjusting and controlling for all that, we were seeing these associations. And so in my mind, these are fairly real associations that we're seeing in Metro Vancouver. So just to quantify the size of these associations, so for those using active modes of transportation for commuting, we found that the likelihood of overweight or being obese was 33% lower compared to car users. For transit users alone, that was just 22%. Still significantly different, but not as much as when you include walking and biking as well. And for walking and biking, nearly 50% lower risk of being overweight or obese compared to regular car commuters. We also noticed that people who commute by cycling, walking, or taking transit are twice as likely to walk 30 minutes or more per day. Going back to some of the evidence from other jurisdictions, those that use public transit in particular can easily fit in 10 minutes of physical activity a day. And this is demonstrating that you're twice as likely to meet that 30 minutes a day guideline. And for those that just bike or walk, not including transit, they're 69% more likely to achieve the recommended amount of physical activity each week. These are huge differences here that are being seen compared to car commuters. Now, one of the things that the Mayor's Transportation Plan is hoping to achieve is to reduce commute time across Metro Vancouver. And currently, based on the data that we collected, so on the far left is the overall commute time. So the median is 30 minutes. That means that 50% of the Metro Vancouver respondents indicated their commute time was 30 minutes or less. Okay? And there's a further breakdown there if you look at the bar charts. For car commuters, it was 25 minutes, and for transit, it was 45 minutes. And I think that's really where the investments from the transportation plan is going to make a difference. It's really trying to reduce that commute time for those that use transit from 45 minutes down to something more like 25 minutes, similar to car users. For those that cycle, it's 25 minutes, and for those that walk, it's 15 minutes. Now, when we looked at car users, just car users alone, we wanted to look to see whether their sense of community belonging decreased with increasing commute time. So the longer time you spent in the car, did you feel less connected to your community, however you defined it? And we compared those car users with less than 10 minutes commute time in one direction compared to those that have a 10 to 20 minute and in 10-minute increments. And you can see that there's a steady decline in their sense of community belonging as their commute time increases. So for those that are with a commute time of 50 minutes or greater, they're seeing a nearly 56% decrease in sense of community belonging compared to somebody who has a less than 10-minute commute. So from the social connectedness point of view, that's a fairly significant finding. And what that means is that the less time that we spend commuting in our car means more time with our community, however we choose to define it, whether it's your immediate family, your geographic community, or whether it's some sort of social activity club that you're part of. The other thing we were able to examine was to see who were some of the highest users of transit in Metro Vancouver. Not surprisingly, the highest users were amongst those aged 18 to 29 and those aged 70 plus. I think those of you in the room will be familiar that there are subsidies available to some of those age groups that would encourage them to use transit. Surprisingly, we also found that there was a 14% higher use in those with any chronic conditions. And I think when we think about the transportation plan, which includes increase in service like Handy Dart, that will help many people with chronic conditions, I think it's a right investment to be made. Not unsurprisingly, we also found that there was much lower use in parents with dependent children under 18. I think those of you that are parents will realize that sometimes a car journey may be the most easiest and less stressful way to achieve the various activities that you need to be at. In terms of visible minorities, we found a 50% higher use among visible minorities, with the exception of the South Asian population, and 73% higher amongst Aboriginal people. And what's interesting when we think about the visible minorities is also think of that in context of immigration. And certainly the highest users of transit are those that are the most recent immigrants to Metro Vancouver, having been here for 5 years or less. And it's about 30% lower in those who immigrated 16 or more years ago, and those born in Canada. And the flip side of that is that the longer that immigrants have been in Canada, the more likely they are to drive. That's what we're starting to see. Thank you for that point. And I'm in that group. So the point being made here is that most recent immigrants aren't eligible to vote in this transportation referendum. And the reason being that it's only open to those that are Canadian citizens. We know across Metro Vancouver, 75% of the population are Canadian citizen, 25% aren't. So there's 25% who will be contributing to this tax but have no voice in it. And that includes me. I'm not a Canadian citizen yet. And when we look at transit use in relation to increasing household income, what we found was that highest use is obviously in those with household income under $20,000, but it decreases sharply with increasing income. And in particular, once you get into that 100,000 plus range for household income, there's a near 70% decrease in the use of public transit. So how does this look across Metro Vancouver? We did a couple of maps to kind of illustrate. So this first map is looking at the proportion of active transportation users, so that's walking, cycling, or taking public transit, across Metro Vancouver, in relation to the existing transportation infrastructure as well as the proposed. The existing infrastructure is the solid lines, the proposed infrastructure is the dotted lines. And first of all, you'll notice that there's two shadings to the map. These are, the darker shading represents those communities and neighborhoods where there is higher than average use of active transportation. And you can see that it's largely in Vancouver, as well as some of the regional centers, like Richmond, Surrey, New West, Burnaby, City of North Vancouver. And what we found was that of those in the dark purple, those that is higher active transportation users, they were less likely to be obese and more likely to meet physical activity goals. So there's a significant difference there. The other thing you'll notice on the map are the green triangles that represent new transit service areas that are part of the transportation investment, and the green circles are either new or expanded transit services. So you can see that a lot of those investments are going in the areas that aren't currently active transportation users. The flip of that is this map that looks at car usage, either as a driver or passenger. And again, the dark purple here represents those communities that have higher than Metro Vancouver average of car commuting. And as you can see, not only are some of the proposed rapid transit and proposed B-line services going to make a difference to those communities, but also a lot of the new transit service areas are going exactly in those areas. So fairly good fit from our perspective. And likewise, when we looked at those individuals living in that dark purple area, we found that these were the same individuals that were more likely to be obese and less likely to meet their physical activity goals. And this next map is really just to, if you think about the car-dependent communities in this map, the next map just maps the obesity, so showing all the communities that have a higher proportion of obesity than the Metro Vancouver average. And again, you can see there's a fairly good correlation geographically between those areas that are car dependent and showing higher rates of obesity. And just to extrapolate that a little bit more, this graph examines the correlation between the proportion of residents using active transportation along the x-axis in relation to the proportion of residents using cars on the y-axis. And the first thing you'll notice is, and each of those circles represents a municipality in Metro Vancouver. The first thing you'll notice is that there's a fairly direct correlation here. The R squared is 99.99, which is as high as you can probably get, other than 1. The other thing we've done here is we've shaded each of those municipalities by whether their obesity values in those municipalities is above or below the Metro Vancouver average. And the thing you'll notice is green is good, that's below the Metro Vancouver value, and the red is the areas that are above. And you can see there's a fairly nice pattern that emerges. The only exception in there being Port Moody, it's a green with, but that may speak to other lifestyle choices and behaviors in that community. Anyone from Port Moody here? Oh, okay. All right. Now, that's one way to look at our municipalities. I mean, the other way I think Dale kind of demonstrated as well was around the walk score. So how walkable are our neighborhoods? So this is using data that we obtained from Walk Score and to look at our respondents across Metro Vancouver to see how walkable are their areas. And you can see that Walk Score categorizes walkability in 4 categories. The orange being car dependent, the yellow being somewhat walkable, the light green being very walkable, and the dark green being what's considered walker's paradise. And you can see there's tremendous variation, but the vast majority of walkable areas are in Vancouver as well as the regional town centers again, with the exception of Surrey. And again, not surprisingly, when you start to look at the participation in active transportation by what the walk score is for your neighborhood, what we found is a significantly strong trend. So as your walk score, as your walkability of your neighborhood increases, your participation in active transportation increases significantly as well. And that's about as strong a dose-response relationship as you're going to see. And when we examine the walk score values for our respondents in relation to obesity, what we found is that compared to car-dependent respondents, those that lived in neighborhoods that were classed as walker's paradise had 31% lower odds of being obese or overweight, and those that lived in just the very walkable areas had 11% lower odds of being obese or overweight. So again, fairly consistent evidence that we're seeing depending on how you want to assess your built environment. So the key messages from this data is that active transportation users have lower rates of obesity. They're more likely to have positive lifestyle attributes, so the lifestyles that are characterized by healthy eating, meeting physical activity goals, and not smoking. More likely to walk each day as well. And for the active transportation users that are just cyclists and walkers, they are the ones that are most likely to meet the recommended 150 minutes of physical activity a week. Now for car users, those with longer commute times have a much lower sense of community belonging, and that probably has impact on social connections down the road. And then in terms of transit use, the highest is among lower income households, visible minorities, and recent immigrants. So what does that mean? In reality, I think it spells out what we've always known, and I think it speaks to the fact that the current transit infrastructure doesn't equally benefit all communities in Metro Vancouver. And the goals of the Mayor's Transportation Plan may help to address that somewhat. Now, transportation is also a social justice issue. If we think of transportation as providing access to opportunities, in particular when we think about education and employment opportunities, we know that education and employment are probably some of the biggest determinants of health and well-being, and this has been consistently shown for decades. So if our investments in transportation improve access to opportunity in our society, I think what that's going to lead us to is a more equitable environment for all residents of Metro Vancouver. So from that kind of social determinants perspective, we do see these investments potentially having the biggest single investment for population health improvement in Metro Vancouver for our generation. And going back to the Olympics, as much as sometimes I'd like to think that the work that we did was a legacy to the health region, the Chief Medical Health Officer of Vancouver Coastal Health, Patricia Daly, will always remind us that the greatest single public health legacy of the Games was actually the opening of the Canada line. And I think you know, the current day ridership is about 130,000 passengers per day. That's 130,000 more people that are getting some level of physical activity that they weren't getting in the past, or perhaps through other means. And in terms of our ridership, I mean, I think Metro Vancouver ridership is doing very well compared to other cities like New York, Montreal, and Toronto. And I think you've got to take that into consideration when you think about, one, the size of our population, really small, less than 2.5 million, and secondly, the land size as well. We are actually a very small population, and this is the thing that always struck me. You know, when we talk about the quality of life in Metro Vancouver region, how everyone likes to really trumpet the fact that there's a great quality of life, but yet when it comes to making these investments, I think there's hesitation. People need to realize that with a population of less than 2.5 million living in such a large geography, we do not have the tax base to make the investments that are necessary to make those critical infrastructure projects. So we have to look at other options. And I think that's something to bear in mind whenever we consider our current infrastructure, which does provide some of the highest ridership in relation to other cities, but yet we don't have the same population as those other cities. So, for those of you that have yet to vote, which I don't think there's many left in the room, I was going to say keep calm, because I had to laugh when I saw the Elections BC video. I thought it was a rather convoluted way, and certainly if we want our young voters to turn out, I'm not sure many of them will recognize what a mailbox is these days, so that's it there. So I just want to end by acknowledging that this work is a result of a large team that really did a tremendous amount of work since 2012 and since the launch in 2013. I'm very grateful Marisha's here this evening, who's been very much part of our project, the analytical team that's really churning out some of these reports that you're going to see over the coming weeks and months. But in addition, I really want to thank all the participants that took part in the My Health, My Community survey. 34,000 of you that really helped to make this one of the largest community health survey and gave us such valuable information, and valuable information that I'm pretty sure will lead to many more talks down the road. So thank you, everyone.